Okay. Looks like we're good to go. We'll start with you, Michelle. There's requests. Okay. Want to try to get some of these other requests in here while we're talking budgets. So we'll start with, we had scheduled, there was Michelle Della Riva with CFR.
Yes, thank you. As Austin said, I'm Michelle Della Riva, and I'm the Executive Director here at CFR. I'm hopeful that many of you know who we are. We are a not-for-profit agency that has been in business for over 50 years. We incorporated in 1968, right there in Fort Dodge, so that is our home base. We provide services, everything from prevention programming all the way up to our 3.7 program, which is a medically monitored intensive inpatient program. We primarily work with those who have substance use concerns, although over the years, quite honestly, we also work with people with mental health and co-occurring as well as gambling concerns. And what we find is that people that are coming in for services typically have a mental health as well as a substance use concern. Usually, 80% of our folks do. I am here today just to ask for some funding for our highest level of care, which is our 3.7 program, which most people refer to as detox. We had some changes in our funding stream when the alignment happened with IHHS. And over the last 18 months, we provided 1,123 days of services to 285 individuals from Webster County in our detox program. 59 of those did not have any funding source. So what that means is either they come in with no insurance at all, or they come in with Medicaid products, which are Iowa Health and Wellness products. Iowa Health and Wellness does not pay for any of our residential programs. So our residentials are our detox program, our adult residential, our adolescent residential, and then our halfway house. So anything that has where they're going to be sleeping in a bed is what's considered to be residential. Our daily rate for our 3.7 program is $450. So over the last 18 months, that would have been $97,200 worth of services. I give you that information just because if we did not have those detox services available, they would actually be going to the emergency room there in Fort Dodge, most likely. And at the emergency room, they are seen in the ICU, which does take up some of those really critical beds for our hospital. And ICU beds typically are around $2,000 a day. So you can see that our program certainly is more cost effective. Our program does have nursing staff 24 hours a day. When people come in for detox, they are provided with a physical with one of our physicians. And then we also do a substance use evaluation to determine which level of care they would best be served at, for the next point of contact. I know that you are currently establishing your fiscal year 27 budget. What we are requesting is consideration of funding the residents who are coming to our program who do not have funding or are underfunded. The request is for $64,800 for fiscal year 27. That would serve approximately 59 individuals for the upcoming year. And we certainly are hopeful that we could be included. Prior to the change this last fiscal year, up until 2018, Webster County always supported the detox program for those citizens who were underfunded or unfunded. And typically back in those days, so it had been like 2016 and 2017, the amount of funding that Webster County contributed at that time was right around $80,000. So I just wanted to give you guys that context. What questions do you have for me?
Questions?
Yeah, Michelle, I think one of the issues that they were having in the past was These are services that were covered before until the federal government canceled out some of your funding. And that's why you're asking this request now.
These services were funded under our IPN grant, up until the alignment. So when they had the alignment, with the behavioral health system that started July of this year, there was just changes in what types of services they were gonna fund. And, our 3.7 program was one that they no longer funded. If that's the question you're asking about.
Yes, correct. Thank you.
Mhm.
Any other questions?
Other than, what's the temperature at where you're at right now?
It is 83 degrees. So I am enjoying, my vacation. And I heard that there it is a little chilly. So I certainly hope that the gentleman who's taking care of my horses is checking their waterer, because I'm worried about that.
Yeah, it definitely bottomed out the thermometer, so. You enjoy
Yeah.
your vacation. Thank you for your presentation. Thank you, Michelle.
Yeah,
Thanks.
yeah, thank you.
All right, Stacia, I think you're still on there.
Yes, thank you.
Tell us who you are and who you're with and
Sure. So my name is Stacia Timmer. I am the CEO of Elderbridge Agency on Aging. We are a nonprofit organization. We have 29 counties that we cover. Webster is obviously one of them. We do have an office in Fort Dodge and have for many, many years. We do have 4 physical office locations, Fort Dodge being one of them, Spencer, where I am located, Mason City, and Carroll. With that, like I said, we cover 29 counties spanning about 16,000 square miles. We are a staff of about 28. So as you can imagine, we are pretty lean in our staffing. And however, we do a really nice job of meeting the needs of individuals we work with. With that, Elderbridge Agency on Aging works with older adults by definition of the Older Americans Act, which is our federal program that we are under. That is defined as anyone 60 and over. We also work with caregivers, and we also do a very small percentage of our work with adults that have disabilities. With the disability access points coming into play, we have really partnered with them to ensure that they are getting the referrals for adults with disabilities, because I would say 90%, maybe even more than that, of our funding is really directed towards those that are older individuals. With that being said, we provide non-Medicaid services. So if somebody is on Medicaid, we are directing them to their MCO. We work with individuals that kind of fall in that gap between qualifying for Medicaid or not being able to qualify and having Medicare. With that, we don't charge Medicare for services. We don't have a quote charge for our services, but I tell people, and I have gone to many other boards of supervisors meetings, we do this every year. Anyone 60 and over really can call our office and receive services. They can be in the form of many different, designs. Information and assistance. If somebody is calling, wondering about aging services, what is available in Webster County, where can I go to find housing for somebody that is older and has a need for assisted devices, etc. They can call. We are really experts in all aging matters, is kind of what I say, and we can provide that information. We also have options counseling, which is more of a short-term program. Let's say somebody comes in and does need different housing, older adult housing. Maybe they need housing application assistance, which can be a nightmare to go through. We can help individuals with those processes, walk them through that. If and when we feel like they maybe need long-term service supports, case management is another one of our programs. That can be a long-term support. I should explain, we don't provide a direct service necessarily, but what we will do is we coordinate services with other service providers. So for example, in Webster County, we do have some contracts like with Respite, Golden Day, Adult Day. We have a small contract with them. We have funding that is designated for that specific goal in providing direct providers in those counties to be able to offer services to individuals at a lower cost. Like I said, nobody that receives our funding through contracts can charge them. It is a contribution base only. And we are mandated to provide a certain percentage of our total funding to service providers so that that service is available in all 29 counties. We also do caregiver services. So we do caregiver supports. We have caregiver meals. We oftentimes are focused on the individual that's aging and kind of don't give the attention that caregivers deserve and need in order to continue to care for those loved ones. Our whole focus and goal with Elderbridge is to keep people aging in place where they want to be. 100% of the time, people will tell me that's in my home. And so we do what we can to provide sort of a social support network to ensure that they are getting the services, they are getting the resources, the assistance that they need to remain in their home as long as it's physically possible. With Webster County, and I know I was scheduled to come see you guys next Tuesday, so I'm not sure if you received the county report that we divvy out every service that we've provided in Webster County with a cost to that service. If you didn't, I will email that to your auditor and she can hopefully get that to you all. But just kind of as a reference point, with meals, we do a lot of congregate meals. We do a lot of home delivered meals. In FY25 in Webster County, we provided sorry, I muted. We provided 11,000 congregate meals and over 1,900 home delivered meals just in Webster County last fiscal year. We have seen an increase in demand for services, but we have not seen an increase in any federal or state funding to meet that demand for need. In fact, since 2020, we have seen a $1.5 million deduction in federal and state funding. We have not seen an increase in state or federal funding for as long as I have been here. And I will also point out that Webster County has not provided funding from the county level as long as I've been here either. I think that has even gone back further than how long I've been here. However, we do provide service in Webster County. I have a whole list of services that we are providing. In fact, the total cost of all of our services in FY25 was around $335,000 just in Webster County. With all of our other counties, the way that we request funding is by taking the population of people 60 and over in your county, which right now is at 27% of your total population at 10,017. We take that, we are asking for $3.30 per older individual in your county, which brings my ask this year to $33,000. This is how we do it. This is the same calculation that we use in all 29 of our counties. Like I said, we get county support from all of our other counties. And I'm hoping that Webster County can be one and join the other 28 in supporting us at the county level. With that county funding, we put it right back into services within Webster County. We use it to support providers in Webster County, but more importantly, we are putting it back into services to keep the people in Webster County in their homes where they want to be. I know property tax is a huge discussion and hot topic this year. I can't tell you how many times I have individuals come into our office saying, my property tax is going up and up. My Social Security is not. I don't know how I'm going to stay in my home, especially when now I can't really take care of the things I used to care for because of my physical limitations. And with some services that we are able to provide and help offset the cost of some of those, we get those services in there. That frees up maybe some income and money for them to pay the other things they need to pay for to stay in their home. It's tough. And like I said, I really pride our agency in keeping people in their homes and as independent as they can. So with that, I will take any questions. And like I said, I am happy to email out this county page so that you have the numbers and figures in front of you to make a good decision.
Yeah, I guess before anybody else gets on, yeah, if you could email that out to us,
Sure.
I was just looking to see, I don't think I had it. So if you could send that to us, that would be great. Any questions from the table?
Got a comment. I do know going through CICS when we're going through that change in the deck chairs on the sinking Titanic, Elderbridge was something pointed out that counties could shift their money to take care of some of the holes being caused by the transfer of all the medical services from one way to another. So just something that's come up in the board meetings I've been in.
Anything else?
Are you required to have some type of a federal match for your federal fundings that you have?
We are.
Is that usually why you ask the counties for this, for the funding?
That is part of the reason we ask counties, cities, and other public funds. With federal funds, we are required to provide a match, which means basically we have to find other local non-state funds to show that we have match to pull down more federal funding. Without that match, we can't request, which is not always there or available, but we are not able to pull down as much federal funding as we are allowed by rules and regs. So it is important for a number of reasons. And yes, thank you for pointing that out. That is one thing that we will look at with our local public funding.
Anything else?
I appreciate your time this morning. Thank you for the information. Once we get the other information you're going to send us, we'll be able to take a look. As you very well know, our budgets are extremely tight, but we will take a look at it and get back with you in the future.
Thank you. I appreciate you guys taking the time to have me here today. Good luck.
Thank you.
I appreciate it.
Yep. Have a nice one.
You too. Thank you.
Thanks.